So I'm doing an interview with Evie Hill. She is a former Rockland resident that is now away in college. And I've taken care of Evie for quite a few years, right, for a variety of things. But most recently, she was off in college playing volleyball for her school and had developed a problem. So tell me about what you were experiencing with your knee, Evie.
Well, I was told by doctors at first it was patellar tendonitis. So, at first it was mild. I just kind of had some pain just like in the kneecap. So it was kind of an ache. Didn't really affect my playing that much. But after I, went to college and I was doing a lot more on it, it was just really sharp pain, like right below my kneecap. And it was really hard to keep jumping and moving around a lot because I would just be in a lot of pain. And it was also like I could tap on it and feel it too. So if I hit my knee on the ground, that would hurt a lot too.
And so when you came to see me, you had been away from playing and practicing for some time.
Mm-hmm.
How long had you not practiced or played at that point?
I would say a little over a month because our season ended in November.
Okay. And so I remember the first time I saw you, you were pointing to your kneecap, and then you had pain between the kneecap and what's called the tibial tuberosity, which is just that area below the kneecap. And when I would tap on that tibial tuberosity, it was extremely tender for you, as I recall. And
Mm-hmm.
that's very common with people that have a condition called Osgood-Schlatter's disease. It's something that happens a lot in very athletic young people where maybe their bones are growing so fast that literally it's like that patellar ligament is trying to avulse or pull right out of the bone. So while technically you're past the age to have that, that was one of your big tenderness complaints there. And describe also when I first saw you, were you able to do just a body weight squat with pain or comfortably?
I could definitely not do it comfortably. That was probably what hurt me the most. So squatting all the way down, that gave me a lot of pain.
Okay. And you weren't able to do any jumping at that point?
Well, I was able to, but it just, I mean, it of course hurt a lot.
Okay. So we started using Softwave TRT therapy to reduce the inflammation, to push out what are called the senescent or zombie cells, stimulate new vascular growth patterns in blood vessels, and also stimulate stem cell mobilization to that area being treated. So I believe it was the third or fourth treatment we did on you, and then you were actually able to go snowboarding. Is that correct?
Yeah. Hmm.
Okay. And as I recall, it didn't really hurt when you went snowboarding?
No, not at all during, which usually that definitely would have with the amount that you use your knee. Maybe there's a little bit of an ache afterwards, but by then I could tell I was already doing so much better.
Okay. Um, and I think I saw you visit six you came in, so we had treated you five times. And this was over about a 3 to 4 week time frame, I think. And you already had begun jumping again and relatively pain free. Is that correct? Okay, perfect. So, and now you're back at school. This is early to mid February. That we began treating you really first part of the year when you were home visiting during Christmas break. And what are you doing now?
Well, I've started practicing a lot more, so now we have about two practices per week. They're like an hour and a half, and then we also have weight training, which is three times a week, and that's for about an hour. So I've been doing a lot on my knee. I've been squatting with a lot of weight, jumping a lot as you need to in volleyball, and I have no pain while I'm doing it. Of course, it didn't all go away. Like I still have some aches afterwards, but it is so much better. Like everything that I couldn't do before I could fully do now.
Okay. So in general, this is something, I mean, would you encourage somebody with your condition to try it, to see if you can get better faster and heal more completely?
Yeah, definitely. I think with this, what was really hard is that every time I went to someone or any trainer or doctor, they kind of just told me, oh, you have to just keep icing it, or like go to a physical therapist, do some, like, they'll give you some exercises, but I was never given something that was actually helping me right away. So I would definitely recommend this. I mean, there was some pain while doing it, and that's needed. But it's already improved a lot and will hopefully improve even more.
Okay, perfect. All right. Well, thanks for taking time out of your busy student schedule and calling us from your dorm.
All right, thank you.
Okay, we'll talk soon. Bye bye.
Okay, bye.